Hi, my name's Morag Purvis and I'm the Operations Director for Hadrian Health Care. Hadrian Health Care is a small private care provider that operates mainly in the northeast of England. We currently have 6 locations. We have Gosforth, we have where we are today at Wickham, we have Barnard Castle, we have Knaresborough, Wetherby and Alton, just on the outskirts of Leeds. And in September of this year we'll be opening our new flagship home, which will be in Harrogate. The homes predominantly provide social care, but 2 of our locations do still provide nursing care. That is Wickham and Wetherby. Harrogate, at this moment in time, we are thinking will also provide nursing care. We've been involved with Learning Curve for in excess of 7 years now. We've used them under the old NVQ framework, we've used them for distance learning, and we've used them obviously for the apprenticeship framework. All of our staff get the opportunity to undertake training, be it the distance learning, which is promoted quite heavily, or be it an apprenticeship. It's given our workforce the skills and the experience that they need to perform well within their job role, but also to raise the standards in terms of the service we provide, and also increase their knowledge in the industry in general. Many of the staff have progressed through the ranks, if you like, having completed various levels of training, and some have gone on and left us, which is unfortunate for us, but good for them to further their careers within the industry. Over the last few years, we've probably had between 180 and 190 who've completed apprenticeship frameworks with Learning Curve. At the current time, we have approximately 20 who are on the new programme, which obviously only came in May 2017. We were a bit slow to get signed up with it being a new process, so none of those learners have completed and got to their end assessment yet. And we also, on average, probably have undertaken around about 150 distance learning courses per year with the group. I think you can look at that in 2 ways, because we've maybe had learners who came to us with no qualifications, who didn't perform very well at school, didn't engage for lots of different reasons, have maybe come into this industry because they saw it as suitable for them, but then have become quite passionate about what they've done and have been encouraged and supported by their own managers to then complete qualifications. Then we also have staff who have maybe started on a level 2 qualification but have moved on to 3s, some have moved on to 5s. That's led to promotion for them. They've maybe moved from a carer to a senior to principal and deputy. We have deputies that have undertaken level 5s and other training and are now managers with us. It's always been very positive. They've always described their assessors, as they were called under the old framework, the talent coaches as they're called now, as very supportive, accessible. They have set times when they turn up to see them. They're available at the end of the phone. They're always quite clear on what needs to be achieved and within their time frames. If they've got particular issues, they're always able to negotiate those a little bit. So the support's always been there for them. Most of them have enjoyed the training. The distance learning historically has always been very popular as well. It just, it counts towards CPD for our nurses. So they like to do those courses. I still do them myself if there's something new that comes on, because I like to see what they're up to. It gives staff the opportunity to have a bit more confidence in their abilities and in their roles. It sort of provides background knowledge for them, helps them understand why they're doing what they're doing in the way they're doing it. We have a long-standing established relationship with Learning Curve. As I mentioned before, we've used them for in excess of 7 years. That's developed a very open culture, very accessible. I can pick up the phone and speak to anybody in the office. Usually I know who I'm talking to. Similarly, they can speak to our head office and our teams and they know who they're talking to. It's a good working relationship, it's very supportive. Obviously it's also helped They've also steered us with new courses. They're very keen and quick to offer us whatever is available and help us navigate that and allocate staff to the courses.